Hello, and welcome to today's webinar on forest, human well-being, and mental health. Before we get started with today's discussion, I wanted to share a few quick announcements. First, many thanks to those of you who submitted questions for today's program when you registered. You can also ask a question as the program is taking place in real time. There's going to be a Q&A feature on the dashboard, and you can enter your questions there. And we will be monitoring those questions throughout the program. Please use the Q&A tab to submit questions for the presenters or to communicate with us if you have a technical issue. This program is being recorded, so once it ends, everyone who registered will receive an email with a link to the recording, and that will happen in about 2 weeks. My name is Dennis Stoley, and I am the Senior Director of the Office of Applied Psychology at the American Psychological Association. The APA is delighted to be collaborating on this webinar with the World Wildlife Fund and the Society for Environmental, Population, and Conservation Psychology, which is Division 34 of the APA. Here at the APA, we are dedicated to bringing psychological science to bear on issues of sustainability and responsible human decision-making and behavior regarding our climate and environment. We intend for this to be the first in a series of 3 webinars dedicated to forests and psychological science. Further, beyond this webinar, we look forward to fostering continuing collaborations with the World Wildlife Fund and the Society for Environmental, Population, and Conservation Psychology. I'm delighted that we are joined today by Amy Smith, who is WWF's Director of Sustainable Rubber and Forests. Welcome, Amy.
Thanks so much, Dennis. I'm excited to be part of WWF's first webinar with APA. And for those of you who aren't familiar with World Wildlife Fund, or WWF, we're a leading global conservation organization operating in 100 countries with around 8,000 staff and 5 million supporters globally. While some of you may be familiar with our work to conserve ecosystems, to protect critically endangered wildlife, and confront climate change, you may not know about the work we're doing at the intersection of forests and human health. And this is why we're delighted to have this opportunity to share more with this audience about that part of our conservation work. Forests are indispensable to human health, providing food, fuel, and fiber that support people's health and their livelihoods. They also filter our air, purify the water we drink, and they help mitigate the hazards of climate change with their carbon capturing abilities. But the relationship between healthy people and forests is even more complex. Forests can reduce the risks of cardiovascular and respiratory diseases, cancers, and mental health issues, resulting better and more equitable health outcomes. In fact, protecting forest loss and degradation is our most effective means of preventing infectious disease outbreaks such as COVID-19. Forests also protect against physical hazards such as flooding and extreme weather and other health issues that threaten human lives. Unfortunately, public and philanthropic funding, healthcare systems, insurance models, and land use planning priorities typically don't reflect the importance of forests to human health. Through our Forest and Health Initiative, we're working to change that by raising awareness about the important link between forest health and human health, and fostering collaboration across a wider array of partners. The aim is to prioritize forests and advocate for conservation across a wider array, to prioritize forests, advocate for conservation as a meaningful public health solution, not just something that benefits animals or business. And this is why we're collaborating with APA. By breaking down these silos and forging partnerships with organizations that have very different expertise than ours, we have a much greater likelihood of approaching the problem from different angles and together coming up with more effective solutions that ultimately will lead to better forest and human health outcomes. So with that, I'm going to hand it back over to Dennis. Great to be with you all. Thanks.
Thank you so much, Amy. I'm pleased to introduce our panelists for today's discussion. We have with us Annika Turanne. Annika specializes in the global market and trade of forest products. Her expertise includes sustainable commodity production and the mechanisms for demonstrating responsible practices within deforestation driving supply chains. Annika spearheads the WWF US Forests and Health Initiative, which aims to document how deforestation can undermine human health and economies, how companies and the public sector can improve efforts to curb future disease outbreaks, and how we can integrate the human health benefits of biodiversity into meaningful action. We are also joined by Dr. Dacher Keltner. Dacher Keltner is a professor of psychology at UC Berkeley and the faculty director of the Greater Good Science Center. Dacher's research focuses on the biological and cultural evolution of compassion, awe, love, beauty, and humility, as well as power, social class, and inequality. Dr. Keltner is the author of many scientific articles and several books, including Born to be Good, The Science of a Meaningful Life, The Power Paradox, How We Gain and Lose Influence, and Awe, The New Science of Everyday Wonder and How It Can Transform Your Life. Dr. Keltner has won many research, teaching, mentoring, and service awards, and he is a member of the American Academy of Arts and Sciences. He has consulted for many major corporations and has been a scientific consultant for major motion pictures. We are also joined by Dr. Michelle Kondo. Michelle Kondo is a research social scientist with the USDA Forest Service. She is stationed in Philadelphia. She holds academic degrees in civil engineering and urban planning and obtained postdoctoral training in epidemiology at the University of Pennsylvania. Her research examines nature and place-based strategies and clinical interventions for disease, violence, and injury prevention with a focus on underserved urban communities. So with no further ado, what I'd like to do is turn to a series of short substantive presentations, and following that, we will engage in a discussion about these interesting topics. And so, Annika, if you're ready, I will go ahead and turn it over to you.
Wonderful. Thank you so much, Dennis, and happy to be here with you all. I'm going to jump right in. Starting in 2019, our forest and health work aimed to better document how deforestation can undermine human health and local economies, and how we might improve efforts to curb future disease outbreaks. But since then, we've been able to illustrate that, broadly speaking, forests play a much wider, more comprehensive role in our health, and that we can do our part to elevate the contributions of forest protection, of management, and restoration to public health alongside their importance in addressing climate change and the biodiversity crisis. Next slide, please, Mark. So if there's one thing that you can take away from my portion of the talk today, it's that at WWF, we know that addressing climate change without forests is not possible. We know that addressing the biodiversity crisis without forests is not possible. And now we know that addressing human health without forests is also not possible, and we have a role and a responsibility to play. So WWF developed a framework for understanding and acting on this relationship, which we hope can provide anyone with a way to understand how their health can be influenced by forests. And it takes the view of human health as both a global, but also a very personal issue. Importantly, it provides a balanced analysis of the role of forests in human health, recognizing that they can negatively impact our health in some ways, but that protected, well-managed, and restored forests can overwhelmingly contribute to human health and well-being. Next slide, please. So there's a lot going on here in this figure, but it's important to spend a bit of time on it because this is the framework that we've been able to use as we reflect further on our work. This is the figure that explains for us the many interactions between forests and human health. And you can think about this figure in terms of how forests affect your individual health, the health of those around you, and the health of people elsewhere. From left to right, this figure spans healthy and intact forests on which people directly depend for their health and well-being, to people that live in cities and whose dependence on forests might be less immediate, but is still significant in different ways. And there are many ways that forests can impact our health, and also many ways that we can affect the ability of forests to provide for us, to prevent health issues, and also to play a role in healing us where we might have health issues. The function of forests, though, does depend on many interacting factors, both within and outside of our control. For example, no amount of forests are going to be able to compensate for the fact that I can and will slay a sleeve of Oreos in one sitting. And this is a paradox that plays out throughout each of these contextual factors. A larger scale example than me and my Oreos is the beautiful state of West Virginia, for example. It's the third most forested state in the country, but it's also considered the least healthy. So there's a paradox there to be examined and considered if we're to do anything about the benefits that can be realized from forests. So when we understand public health on an individual level, we have all sorts of mediating factors that limit our ability to realize the health benefits of forests. And these include social needs and demands, access to forests and their accessibility, the proximity and affordability of forests, and pre-existing health conditions that may or may not be unrelated. So how forests provide or prevent and heal for each of those populations that you see here, from forest dependent living in and around forests to more remote, will differ. And the role forests play in individual to population health can be maximized with intentionality and with an expanded way of working than we tend to see now with those strict silos of public health and conservation, among other disciplines. And I also just want to note that while I won't talk a lot about climate change today, climate change, of course, plays a massive role in the intensity of these factors. And you can think of these effects as being woven in through what I talk about. Next slide, please. So our framework relies on these 5 categories of what we call nature's contributions to human health. And these are the 5 categories I wanted to point out that are described by the Intergovernmental Science Policy Platform on Biodiversity and Ecosystem Services. For each of these, we've explored the scientific research that aligns these categories directly with forests, but I'm going to talk about a few of these only. Next slide, please. So the first example I'll highlight relates to non-communicable diseases. Now, NCDs are non-infectious diseases that cannot be transmitted between people. They include cancers, chronic respiratory diseases, cardiovascular disease, diabetes, and mental disorders. The number of studies specifically evaluating the benefits of forests to NCDs is relatively new, and as a result, there's not a large body of literature from which we can draw, or certainly not as large as we would love to see. However, when we understand the common risk factors of NCDs, which include poor diet, pollution, physical inactivity, we do see more clarity as to the role forests can play. And forests, they play a strong role in providing healthier diets, in preventing pollution, mitigating pollution, and healing the consequences of a sedentary lifestyle. The most direct evidence comes from a number of studies that demonstrate that exposure to forests reduces stress hormones and confers both mental and cardiovascular benefits. Newer research even confirms that spending time in forests motivates people to make healthier food choices. It's probably the least studied, but most personal and highest impact category for demonstrating the role forests can play in human health. And I know we're going to hear much more about this from my fellow speakers. Next slide, please. I wanted to talk about the connection between environmental exposure and NCDs because that connection is quite strong. Pollution is the largest environmental cause of disease and premature death in the world currently, with NCDs accounting for the majority of the disease burden. Forest loss and degradation contribute to the health risks associated with the degradation of environmental quality, and forest conservation and restoration are an important strategy in reducing those risks to human health. For example, between 1976 and 2010, 15% of the Brazilian Amazon was deforested, mostly through the use of fire. However, from 2004 to 2017, deforestation rates declined significantly, and the improved air quality from the lack of Amazon clearing fires prevented up to, it said, 1,700 premature deaths per year across South America. Let's also remember the role that environmental exposure plays in the incidence of NCDs, acting as one of the primary risk factors for the development of cancers and respiratory illnesses. So we have interactions here. And apart from their impacts on human health alone, they also predispose people to other health risks, such as the role that pre-existing conditions from environmental exposure or other NCDs have on someone's susceptibility to infectious disease. Next slide, please. And lastly, I wanted to highlight the role of forests in physical hazards, including storms, flooding, drought, landslides, wildfires, and extreme temperatures. And here we've found that forests play a protective role in human health. This is where forests can protect. Up to a point, of course, forests can buffer impacts of floods, which they do, but not all floods. They can prevent landslides, but not necessarily all 100% of landslides, and well-managed forests can prevent wildfires, but not all wildfires. Interestingly, forests can protect against the impacts of extreme heat. Next slide, please. And I do want to highlight this example. In the last 40 years, the number of extreme heat events in cities has increased by 200%, affecting at least a fifth of the planet's population and probably many more. If you are in Washington, D.C. today, like I am, you are currently, right now, today, experiencing a peak of an extreme heat wave. In both rural areas and cities, forests mitigate the impacts of extreme heat. And in addition to evidence contained in work that WWF has consolidated, a newer study on the effects of deforestation on our climate again confirms the vital role that forests play in regulating both global but also local temperatures meaningfully. Additionally, research demonstrates that in cities, a threshold of 40% canopy cover per city block is needed to see the cooling effects of trees, which can be up to 5 degrees centigrade. And this is a tangible policy objective we can each take, for example, to our own city council. Heat and its effects have all sorts of compounding issues on human health, and the role of these impacts and others I've talked about have dramatic impacts on how susceptible, again, a person is to disease, other health impacts, and to mental health ramifications. Next slide, please. So this figure on the left details the different elements within public health that we think could be assessed or complementary across the conservation-oriented efforts of forest protection, of management, of restoration, and of creation of new forest areas, for example, in urban or semi-urban areas, to sustain or enhance the contributions forests can make to human health while also reducing existing hazards. So I won't go through this figure in large detail, but wanted to highlight protection of forests as an example. Protecting forests and avoiding their future conversion is essential to maintain the preventative health functions that forests can play, for example, in preventing the emergence and spread of zoonotic diseases, or provisioning functions of ensuring clean water and more diverse food sources, and in providing respite for some of the mental health connections that, again, I think we'll hear more about from my fellow speakers. Next slide, please. Given the variability of physical hazards to humans associated with forests and deforestation in a changing climate, adapting to specific contexts and to types of health needs is really important to forest conservation and management strategies to optimize those benefits to human health. Similarly, elements of defining social health needs associated with managed, restored, or urban forests and advocating for access to meeting those needs are contributions that can really come from those with the health and well-being expertise and from practitioners like some of you in that area. And it's also critical that we as conservation practitioners articulate how our work can meet the short-term and long-term needs of public health professionals and organizations, and where conservation can better advocate for and invest in public health initiatives and infrastructure so that we can all better realize those impacts. Next slide, please. And I'm just going to wrap up here saying, WWF, where we are working to better reflect on how this framework relates to our on-the-ground work and really integrate these connections, specifically in places like you see pictured here in Sabah, Malaysia, where we're restoring corridors for wildlife to reduce human-wildlife conflict, among other implications for well-being of forests and human health in local communities, and in the landscapes of Sumatra, Indonesia, where we're working with communities to really understand what their health needs and priorities are and integrate that into how we do our conservation work, to the forests of Brazil, where our colleagues there are working to increase access to their forested areas to improve awareness and understanding and recreational benefit of forests. And I'm happy to speak more to that as it comes up in our discussion. And I thank you for your time. Over to you, Dennis.
Great. Thank you so much, Annika. There's so many thought-provoking pieces there, and I'm really looking forward to following up in our discussion. First, though, I'd like to turn over the floor to Dr. Michelle Kondo to hear from her with some remarks about some of the work that she's doing.
Thank you very much for having me. I'm glad to be here. Can you go to the next slide, please? So I'm here representing the Northern Research Station of the U.S. Forest Service, and I am stationed in Philadelphia. I'm a research social scientist, and a lot of folks don't know that we have urban field stations. So I will say that a lot of my work focuses in and around urban areas, cities, and urbanized places, and the needs and health needs of populations living in these areas, and the role of natural environments in supporting those needs. And so, I think that Annika has given a very good, overview of very many of the public health benefits that we are seeing. Sometimes now on a minute-by-minute basis, I'm seeing new science coming out, getting published on this relationship between nature exposure and human health. We've seen really an explosion, I would say within the past 5 years, really, of research in this area, and kind of aided by transition to electronic medical records and access to sometimes, nationwide records or data sets, as well as better ability to make use of information coming from all of these satellites that we have access to, as well as other information or data that we get to understand and be able to measure and quantify people's exposure to nature and green space. But we see now good and solid evidence really in benefits of exposure to nature and green space in terms of chronic disease. So improved cardiometabolic factors. We're talking about reduced risk of diabetes, reduced cardiovascular disease. We're starting to see now evidence of reduced incidence of low birth weight. So we're talking about better birth outcomes. And then just general overall better physical health, mental health, so and life expectancy, so reduced risk of premature mortality. We see so many benefits in terms of being outside and outdoors, and our mental health. We can measure through so many means, through our salivary cortisol levels, to our mood and self-reported mental health, that we we calm down, our stress levels lower immediately, often, with exposure to green or forested environments. We're better able to focus, pay attention, so cognitive performance is improved. So let's go to the next slide. We're beginning now to focus in on what we might call subpopulations or groups of people. So people by age, so young people versus elderly versus, various, racial ethnic groups or socio-demographic groups, to understand their needs and response to and better access and exposure to natural environments. For children, I would say there's a lot more research that is needed, but we're starting to see some interesting evidence there of cognitive benefits, including improved ability to focus, so selective attention, sustained attention, and working memory, often associated with ADHD. Also benefits in terms of fewer behavioral difficulties, improves pro-social behavior and emotions. So these are all important sort of developmental needs for children. So go ahead, next slide. And so, there is a lot of evidence out there that I would say is worthy of taking action on, right? And so a lot of my research centers on, well, what can we do about it? What are the interventions that we can work together on to improve access to and exposure to quality natural environments? And I'm not alone. There's a movement there, even within the medical community. So this is from Dr. Yasuda of the American, president of the American Pediatrics Association. And he focuses on, he has one, of his issues here is connecting children and families with nature, one of his primary goals for that year. And he says that, living near parks and woods affects the health of children, all children, yet with many things that promote good health, there's not equal access. So I'm really pointing out there are many barriers to promoting equal access to natural environments. Move next slide, please. And so, so I think the question that I ask and that many others ask is, how can we meet all people, patients, perhaps, where they are to increase nature exposure? There are so many barriers, and they range from individual level barriers to cultural and structural level barriers, right? We might be able to conclude that solutions that hinge solely on individual choice are likely not accessible to those who most need the increased exposure. So taking the sort of clinical or education counseling approach and telling people you really should spend more time outside, go ahead, right? What's stopping you? That might not have the intended effect. So we need lots of supports there. And then go ahead and hit next. What is the role of nature in this sort of new understanding of the sort of medical? This is more of a public health view of medical medicine and practice, and that we need to, at the base, change socioeconomic factors and many of those upstream sort of social determinants of health. We need to change context to make individuals' default decisions healthier. And we also, in addition to complement to clinical interventions and some of the more traditional sort of counseling, education, clinical interventions. So, what role can trees play at all of these levels? Trees, parks, and green space. Next, please. So just talking about changing socioeconomic factors. My agency is just awarded over $1 billion to nearly 400 projects across the US to expand access to trees and green spaces, especially in underserved and disadvantaged neighborhoods. So over the next 5 years, these projects will be unrolling. So this is kind of in part, very many of these projects involve green workforce development, providing jobs, right? So sort of hoping to change these baseline socioeconomic factors through employment opportunities and many other. Next. So we have also, what about changing the context and environments in which people live? There are so many different types of urban greening strategies happening out there. This Trust for Public Lands Community School Years project. There are many that are funded by this IRA funding as well. California State is unrolling a project to green up schoolyards across the state. And there are many across the nation. What impact will this have for children on so many of their aspects of their health? Next slide. I've done some research on vacant lot cleaning and greening in cities like Philadelphia and Baltimore. We found with a randomized controlled trial that cleaning and greening vacant lots, and we have a 600 sample in an experiment, that it reduced violence, gun violence in particular, and also reduced for people living nearby instance of depression, so symptoms of depression, as well as feelings of worthlessness for people living right nearby these treated clean and greened vacant lots, as opposed to those who live near the control lots. Next slide. I'm also engaged in nature prescription programs. So medical institutions are promoting equitable access to nearby nature spaces, nature prescriptions to encourage people to integrate time and nature into their lives, as well as nature programming that involves people in organized activities. Often we need social supports. We need transportation, we need help sort of getting people to the outdoors to address health challenges. Next slide. Yeah, so there's lots to talk about there, but I'll just keep it very brief. So part of this whole strategy is building partnerships between healthcare and parks, recognition. We can just help, build recognition that parks are an essential component of the healthcare system. Healthcare institutions are investing in improving neighborhood environments and parks and recreation facilities, as well as in often on-site healing gardens for patients and staff. You've likely heard of these things. We are putting out tools for, how do you build a partnership that would go about doing this kind of thing. And healthcare providers are giving nature prescriptions, which might have also been called nature-based social prescriptions. In the UK, their healthcare system has invested and sort of gone in. The whole system is now supporting these social prescriptions as a part of healthcare therapy, and mental health is a very primary target for these types of programs. Next slide. This is not new, right? In our country, or in the US anyway, around the turn of the 20th century, there was a strong practice of bringing people, often children and families, outdoors for healing practices. There are, in other parts of the world, of course, this is an ancient practice. Next. And we're starting to see more programs like this sort of pop up. It's a re-emerging practice across the country. Anyway, that's all I have for today.
Great, thank you so much, Michelle. At this point, what I'd like to do is turn it over to our next panelist, Dr. Dacher Keltner. And Dr. Keltner, if you're ready, I'll go ahead and turn over the floor to you.
Thank you, Dennis. What an honor to be part of this webinar and to think together about bringing nature back with all of its myriad benefits to our lives and our societies and our schools and our hospitals, as Michelle was speaking to. And what a terrific honor to be part of a conversation with Michelle's important work and this panel. I want to focus in on a kind of a more specific experience that is tied deeply to nature that my lab has been studying for the last 15 years that I recently published a summary of in this book on awe, and that's the emotion of awe. And I really believe in surveying evidence from different cultures about this emotion, and we'll zero in on nature in particular, that it really gives us hope in terms of thinking about the crises of our times, of loneliness, of dropping life expectancy in the United States the last 2 years, of political polarization, of the breakdown of community, and things like this, and mental health crises, of course, with young people having been on the rise, that awe offers the promise of, and natural awe in particular, of meeting these crises of our times. I have a paper with Maria Monroy from 2022 that summarizes kind of the specific mechanisms by which awe helps us in nature to meet these crises. And today I'll hint at some of those with a couple of studies as we move through our talk. Next slide, please. As Michelle said, this is not a new idea that nature is our best health, both for mind and body. It really is something that people have been thinking about and experiencing and promoting for millennia. This is a very influential quote in the transcendentalist writings of Ralph Waldo Emerson. As many of you know, Emerson had this deep experience throughout his life in nature, and he called himself, in sort of thinking about what he wanted to give to society, a naturalist, which is he really felt that being in nature and our deep experiences of nature and our ordinary experiences of nature really reveal the better sides to human beings. This quote, which inspired some of the research I'm going to talk to you about, really speaks to forests and woods and trees and the fungi that lie beneath the root systems and communicate with the root systems of trees we now know. He was going out on a cold winter day into a commons near a forest, got hit with this experience where he said, "In the woods we return to reason and faith, and there I feel that nothing can befall me in life. No disgrace, no calamity that nature cannot repair. Standing on the bare ground, my head bathed by the Blythe air, and uplifted into infinite space, all mean egotism vanishes." And then he talks about kind of the spiritual dimensions of this experience, that everybody feels like they share some common humanity. He feels what he calls the universal being circulating through him. He was spiritual. But the point is, out in nature, it repairs us, and it does so mechanistically or process-wise through shifts in our psyches, the mean egotism that Ralph Waldo Emerson refers to. Next slide, please. So as Michelle nicely said, this is a very deep idea, I believe a universal part of our human psyches. E.O. Wilson very nicely, and you can move through the images of this slide, thank you. E.O. Wilson called it biophilia, really, that we love nature, that we have just almost a deep, evolved love for natural beauty that is on par with our love for caregivers and parents and the like. I'll talk briefly about the writings of Dr. Yuria Salidwin, an Indian nation who's fought on behalf of climate rights. She calls this ecological belonging, that we really shouldn't separate ourselves from nature. We are nature. We're a species as part of an ecosystem, interdependent on all the species around us. And to illustrate, sort of bring this and to bring substance to these notions, first is the idea coming out of Emerson's writings that some of our deepest ideas, our deepest moral ideas, ethical ideas about how to comport ourselves in the world come from our relationship to nature. And if you scan the writings of Emerson and Lao Tzu and indigenous traditions, you quickly see for example, that clouds are referred to as ways to think about the impermanence of life. We learn about part-whole relationships, how elements are part of systems, for observing waves and storms. Biologists have written about how fractals and the symmetrical design of organisms teaches us about the mathematics of geometric design. We can turn to fires as sort of experiences that teach us the deep moral intuition of how things are destroyed and reborn. And of course, the interconnectedness that runs through nature that we take on in our own moral learnings and ethical ideas. Next slide, please. So to give you a feeling for this, what we've done in our laboratory, and I would, and I'll talk about the broader benefits kind of converging with Michelle's work. This is just one of many studies in which, as social psychologists, interested in the mechanisms, the social cognitive mechanisms by which living near a park, gardening with friends, tending to the flowers outside, watching the sky, listening to storms, listening to water, all the myriad ways in which we can relate more actively with nature. As a social psychologist, we're interested in how does it change our sense of self, our sense of relationality. This is a well-known study conducted while we were really actively investigating natural awe or out in nature by Paul Piff at UC Irvine, who's continued his work on a relationship to trees and forests. He brought Berkeley undergrads to the lab. For 1 minute, had them look up into the trees, a eucalyptus grove, just take in the colors and the sights of the eucalyptus grove. Next slide, please. In the control condition, this is an unfair contrast. He had students standing in the same place at the same time of day, randomly selected, look up at a science building, not so awe-inspiring. Good control conditions because you've got it, you're in the place. Next slide, please. And then as you walk through these figures from this study, next, just keep advancing, please. What you find is, and there'll be 4 images here from this study. Thank you. Think about Emerson's mean egotism. Think about Jean Twenge's research, large samples that our narcissism, our egotism, our excessive self-focus, our rumination are really direct pathways to our mental and physical struggles of our time. And here what we find is a moment in nature, Paul Piff's research. Our students on the left feel less self-important. They feel less entitled. They need less money to do this study, and there's a lot of research on how nature and awe diminish materialism, consumerism. They enhance research from China, our green tendencies, our tendencies to recycle and the like. And then very nicely, our participants were standing there, either feeling awe with the trees or a less awe-inspired state looking at the building. Someone walks by and drops a bunch of pens, typical social psychology, and our people feeling awe picked up more pens. So what this illustrative study tells us is that just a moment in nature really shifts us away from the mean egotism of our times to a whole other way of being in the world. Other research, Daniel Stancato from our lab, nature and awe diminish polarization tendencies, political polarization tendencies, which are probably one of the 2 or 3 central social problems of our times. Awe and nature diminish our sense of trauma. We did a research with the Sierra Club, taking veterans and inner city kids who are in under-resourced schools to go out rafting for a day, a week-long decrease in PTSD, 32% drop in 4 symptoms related to PTSD. Jenny Steller, looking at expansive views of nature just for a minute, makes us more humble, makes us more interested in other people's. So as a social cognitive psychologist, what this work tells us is the things we're really worried about that predict depression, that predict anxiety, that predict consumerism, that predict polarization are diminished by natural awe. So too is our sense of loneliness. Our work shows experiences in nature that bring us awe, make us feel, even if we have those experiences by ourselves, make us feel more connected to our fellow human beings. Vivek Murthy, our Surgeon General, loneliness is at an epidemic level. Nature, awe, diminishes loneliness. Next slide, please. Keep going. Let's round this out. So just feel one more push. Thank you. Michelle did such a powerful job of really surveying this landscape, and I'm so grateful for that careful work. For those of you interested in sort of looking at the psychological mechanisms, I would really recommend Ming Kuo, a nice review paper, quickly becoming a citation classic from 2015. She reviews 21 pathways. Well, let's start with the benefits. The benefits of being in nature, and by the way, Japan, research there way in advance of the United States, South Korea, healing forests, et cetera. You know, you can't find a metric of well-being that isn't enhanced by being in nature. Walking in the woods, being near green spaces, you know, gardening, listening to water, looking at clouds and skies, smelling the fragrances of flowers and trees, all experimentally have been shown to benefit us in different ways. Benefits such as reduced cortisol, reduced inflammation in our research, better cardiovascular profile. Michelle talked about better attention in school kids, the work of the Kaplans and Ming Kuo. And then, you know, if you live near green spaces, big data sources suggest, and Michelle's elegant experimental work, less anxiety, less depression, better well-being. I think Ming Kuo's paper on this is thrilling. It charts 21 pathways by which experiences of in nature change our sense of self. They change our sense of attention. They change our relationality. They change our sense of connectedness. They shift vagal tone. They shift cardiovascular function, levels of cortisol, all in ways that benefit us, including awe, right, as one of the proximal pathways by which we derive benefits from nature. Next slide, please. Next slide. Oop. So thank you. So let me just finish by saying, you know, I want to cite the work of Dr. Yuria Salidwin, her concept of ecological belonging, 25 years in indigenous scholarship, indigenous wisdoms, their nature orientation as being part of nature. I think it's a grounding idea to guide the psychological science of the benefits of nature, forests, trees, and broader. And then I'd also like to just briefly refer to the work that Michelle is doing, and that we're initiating what I've called Cities of Awe, which is, you know, 70% of our carbon emissions come from cities. Cities are, of course, where most humans live. They are hotspots, if you will, regrettably, because of climate crises for the ills of our times, but also the promise. And I'm part of a interdisciplinary network that we're calling Cities of Awe, that it includes people like the Gale Architecture Foundation, which are about greening cities, bringing forests to cities, bringing rivers to cities, changing our experience of nature in cities. It's thrilling to me. You look at Singapore as a model, as the garden city and the things they're doing. And we now know from a recent meta-analysis, this kind of work works. It helps with well-being, with stress, and also with biodiversity. So it's just a small part of taking what I think is this human universal of finding awe and deep meaning in nature, and then figuring out how to return our relatedness to nature back to our lives in cities and elsewhere. So thank you so much, Dennis, for this chance to talk to you.
Thank you so much, Dacher. So wonderful remarks, and we have received so many interesting questions in the Q&A button in response to the remarks from each of you. And so I'm really eager to dig into some of these questions. Annika, what I'd like to do is direct the first question to you, but really it's a question for all of the panelists. I thought I'd just direct it to you first, though, if that's okay. And the question is, really, what are some examples of how biodiversity and ecosystem health have been integrated into human mental health and well-being?
Thanks, Dennis. Yeah, I think my fellow panelists have provided some examples of that, some really strong examples. And I'll just say that I think they're examples to be replicated and further studied, especially just leading with this. Well, one area, for example, is this idea of prescription for parks, but I think that can have very different roles, have very different forms depending on the context. And again, I'll highlight how context specific things need to be, but where we've seen both interesting momentum and support for that closer to urban settings. For WWF, we work a lot on forests that are not in urban settings. And an area that's been really interesting is to talk with those on the health and well-being side of how we can pair these benefits that we're talking about, the idea of awe, and how to have access to that for people who live in cities who might otherwise not be benefiting from the range of contributions that otherwise seemingly remote forests can make. So again, I'm just going to turn back to our colleagues at WWF Brazil, for example, and the work that they're doing with one of the primary hospital institutions and research institutions there for the Atlantic Forest, which is an area where we do a lot of work in restoration and preventing further forest loss. It's also an area that's within a few hours of 70% of the population of Brazil. And so they are looking at how can we increase access to those forests in a tangible way that then can introduce those benefits to that 70% of the population, better exposure, having those human well-being, those mental health benefits, but also better measuring and monitoring those benefits so that we can understand how to adapt further to that. That's one example, and I'll stop there for now.
Great, thank you for that. And I'd like to pick up more on this notion of park prescriptions. And Michelle, I'm thinking of you in particular as I raise this. When I think about say pharmacology, it's sort of fundamental to the field is the dose response effect, right? And so how does that translate at all to this context? And how much time does a person need in order to get the beneficial effects? Is there some threshold, or is any little bit better than none? How's that work?
Well, I wish I could say, there's been a meta-analysis, and, all of these hundreds of studies have found there's agreement, and, have found this. I would say really that we don't have any kind of, we don't have that kind of blanket X minutes equates to this or that outcome. You can look at individual studies that are looking to measure, things like our brain response and performance on cognitive tests or our stress levels, our heart rate, our blood pressure. You can do these things and see it often immediately with things like heart rate, that our stress levels lower immediately, right after we are in a green and calm environment. But for other things, I think we don't necessarily have that information.
Great, thanks. And Dacher, I saw some head nodding there. I don't know if you had something that you wanted to add.
Yeah, it's a hard question. Dose, do 10 trees have the same effect as 20 trees? But I want to pick up on what Annika said. The parks prescription, there are 360 million visits to the national parks each year in the United States. It's bigger than any experience that we have, and we're starting to work on, as Michelle illustrated, like building in an intentionality, and like the Japanese and the South Koreans, treat parks as healthcare. They are healthcare, and so you can do simple things in terms of interventions, in terms of orienting towards parks, taking a moment to reflect on the grandeur, which we intuitively do. And that in part inspired our study of the veterans, rafting for half a day, with support from the Sierra Club, and they had a week benefits of PTSD, that's a big effect, right? And so I think we need more science like that to get to the dose question that you asked, but that'd be one place for interventions too.
Right, that is a big effect. And one of our audience members sent in the question, recognizing that we're primarily focusing on forests here, but what about other natural environments? What about beaches? What about other outdoor environments? Are the effects the same? Are they different? Does it matter? Anyone have?
I've seen there are many studies now where measuring effects of blue space as opposed to green space, right? So, beach environments are just views of water, right? So we're starting to see a whole, like a body of research. You can draw a line around it, right?
Yes.
Yes.
Yeah, and Ming Kuo, it's exhilarating. There are studies of fragrances coming off of trees and flowers that show effects on the vagus nerve, I think. There are studies of particular colors, as Michelle said, green patterns, and sounds. There's increasing work on bird song and the sounds of running water and waves that are beneficial. So we're pretty wired up to benefit, I think, from nature and in its sensory modalities.
And I'll just add that's the bird song in particular, I find really fascinating, and I know there's increasing attention to that. I also know this is an area that we do need more understanding, where there's some studies that show that definitely natural environment versus synthetic environment, there is a difference in how humans might receive benefits and the type of response. Similarly, forest or tree cover has more benefit than, say, a lawn or green space that's not a natural environment. So those are areas too where it's not one for one, but at the same time there's evidence that shows seeing imagery of beautiful things and can also produce a response. So I think the degrees are going to be different, and the appropriateness of that strategy will intersect with those mediating factors we talked about, like accessibility and what the issue is and how to reach people.
Great, thank you. And we're living in a time of such rapid technological advancements. Do any of you think that there's viability to artificial nature interventions, virtual reality headsets that put you into a forest, machines that provide bird songs in your bedroom when you're going to sleep, these kinds of things?
Well, I can start and just share that I will say that nothing beats the real thing, and we do need to continually get ahead of further eroding the natural resources we have that are out there. And so the technological responses are not going to be sufficient to replace those. Others might have additional specific views on the very specific things that some of those technologies, the role that they certainly could play.
I would agree, I think, and experimentally, BBC Earth can produce a lot of shifts in your brain and in your body and feelings of awe and so forth. But, across the forms of awe, direct experience is, I think, essential. And then one would worry about, and you could think about settings, hospital settings, where technologically delivered nature and awe could be beneficial. But I just worry about the eroding and degrading of that primary relationship to nature that could bring about, reliance upon that.
Yeah. And here's where we can and continue to, and this work has been ongoing, to engage with architects and landscape architects and urban designers to really rethink buildings and our movement and patterns through buildings, right? So that we get maximal exposure to outdoor views, at least.
And there's this. It astonished me on that, Michelle, the rewilding movement in schools. It's just starting. You can take a 10 by 10 foot square plot of a playground and plant a bunch of native species, and boom, you have a a little piece of forest or whatever it is that's has carbon capture benefits. And so I think there are ways to do this work in many outdoors with direct experience.
Great, thank you. And as you know, in our audience today, we have many people from all walks of life. We have many psychological scientists, though we also have many psychology practitioners whose practice is ultimately based in psychological science. And I think maybe each of you come at it from a different perspective, but my question for you is, how can psychological science support those who are working on deforestation and climate and sustainability issues? Annika, do you want to jump in on that one?
Sure, happy to. So my colleague Amy, who gave the beautiful introduction for WWF, Amy has led pilots at WWF on mindfulness in our work. Amy, I'm going to gush over you and the effect that has had, I know, personally and also individually with other colleagues, really at looking at how can we cultivate resilience as individuals in light of some of these really big, enduring issues like climate change, like the physical hazards I talked about, but that can be really traumatic. So both for people who are really working, yes, on these issues, but also those on the front lines of these issues, the indigenous communities that are subject to the harms that come from land use change, for example, park rangers who are doing work to steward some of these parks that we're talking about. I think that there is a role for psychological science and for mindfulness and for what that brings. Amy, I invite you to share a few more things about that if I didn't do it justice.
You did it justice. I'll just add that I think in light of the type of work that we're doing at WWF and the complexity and the enormity of the issues that we're trying to address, that I saw a real need to bring some of the mindfulness practices that I've been applying in my personal life for a long time to my colleagues as a way to, as Annika said, to support us in doing this work and being more resilient in being able to hold all of it in its many facets and some of the stressors that we're all under. And this is something that has been really happening for the last several years, and there seems to be a continued interest on behalf of our staff here in having more offerings of this type. Thanks.
Dacher, did you have anything that you wanted to chime in on with that?
No, I completely agree with Amy. It astonishes me how the well-being literature often isn't implemented in communities that are promoting well-being dramatically, like healthcare and care of the environment. And so we need to import that wisdom in and hope we can help.
Great. And multiple times throughout the remarks and the answers to some of these questions, we've mentioned indigenous communities. And so I invite any of you to comment further on that. Why is that coming up? Why is that important? And are there efforts being made to seek the guidance and expertise of indigenous communities? And if so, what does that look like?
Well, I'll weigh in. I'm lucky enough to collaborate with Dr. Yuria Salidwin, who's at the UN, and she has been fighting for climate rights and indigenous people's rights for decades. And why it surfaces now is 80% of the world's biodiversity is in the indigenous worlds, 500 million people worldwide. And they also have a radically different view of our relationship to nature that still is hard for me to grasp. And it's one of reverence and interconnectedness. And so there's a lot, not only with respect to environmentalism that their perspective offers, which she's championing, but also how to derive health benefits from to be healthier in nature. I think I work in the world of well-being, it's astonishing to me, as Dr. Yuri Solidwin has suggested, when we measure well-being, we measure individual well-being. Maybe we'll measure, if we have the right tools, the well-being of a neighborhood. We never would measure environmental well-being. We can, but that hasn't been integrated. So I think there's a lot of essential work to do alongside protecting the environment.
Great, thank you. Annika?
Yeah, I'll just add, I mean, that can't be overstated that, a lot of what Dr. has said, but then also, I believe was reflected in one of the questions, a lot of the drivers of forest loss are the drivers that came with colonialism and came with significant harm to indigenous communities and still do. And so our solutions must reflect indigenous perspectives accordingly as well, for a range of reasons. They're on the front lines of stewardship for the world's remaining forests. They're also on the front lines of these harms from forest loss. And then also what Dr. shared, that there's just enormous learning still as we aim to right our relationship with nature.
Great, thank you. And all of this work is so important, but it can't be done without the proper resources being made available. And Michelle, in your presentation, you talked a little bit about some of the funding, and I wonder if you'd be willing to comment a little bit further about that and some of the ways that the dollars may actually be spent, for example, some of the ways that the people who have joined us here at this webinar might be able to do some small share of their part to encourage more funding for this kind of work.
Well, let's see. So in my, so the IRA funding that's coming through, and Philadelphia is one of, a couple handfuls of cities that are getting, the city will be getting $12 million here, right, to invest in urban greening, urban forestry projects, and solely in neighborhoods that have been disinvested over the years. And so the cities like Philadelphia and others across the country are having to really rethink their methods. How are we going to do this? I think that, and if we assume intentions have been good, despite that, right, we still see inequalities in terms of our tree cover and our, the health and spread of parks and tree resources. And so a lot of this funding is going into, developing new methods, new partnerships, and we aren't necessarily, what are the metrics? How are we going to tell if the money worked, the investment worked? What should we measure? Well, should we, the traditional method is take the satellite view, take the photo before and after. Are there more trees or not? And we're having to rethink that perhaps it's the relationship, the capacity building, ownership over, residents' ownership over their livelihoods, right? Employment and jobs, and ownership over, programs, educational opportunities that kids are getting. And leadership opportunities, et cetera, that we might need to measure instead, in addition, and or instead. So let me think. I'm also engaging, at the Children's Hospital of Philadelphia. We're always looking for people, with clinical training to step in and to help lead. Therapy programs or nature-based therapy to sort of gain that kind of special training, to work with patient groups, right? And yeah, so we also are looking for this key ingredient of a link worker or connector. So connecting people and patients, based on sort of kind of like a triage. What is it that you need and what's available out there, and where would you, best fit, and how can I help you and support you to engage or join a program or an activity. And so speaking of funding, I think, and perhaps I'm going a little bit tertiary, but we don't want to forget that funding is really needed. And some of these sort of wraparound, sort of thinking about social work and case worker sort of services and needs.
Great, thank you. Annika, Docker, anything to add to that?
I really just wanted to underscore what we've just heard from Michelle. I mean, there are numerous obstacles to getting the level of funding that's really needed to for the wide swath of interventions that are also very much needed across just the forest conservation side, across the mental health and well-being piece, large piece. But really that part of the interest from WWF to better understand this was to figure out how to do our conservation work better, but also because it's harder to ask for funding for something if we don't fully understand what it is that we would be funding and what the best interventions are. And so just on that data and monitoring piece and understanding all of that is just a really important element of the progress toward really advocating for funding more effectively, and then getting that funding to where it needs to go. Again, not to underemphasize the level of challenge that can be there, but I think with the disciplines that are working together, we have a much stronger ability to advocate successfully.
The only other thing I would note, Dennis, is also to look to other cultures and countries where there is such sophisticated intervention work and science, that Singapore, Japan, South Korea as kind of models in the UK. So there's a lot going on to unite across cultures.
That comment actually leads right into another question that has been put forward by one of our audience members, which is, so what is the work going on with regard to looking at cross-cultural differences, specifically with regard to awe or with regard to other reactions to nature? Because as you're saying, we're seeing research from all over the world, but to what extent does it generalize, and to what extent is anyone looking at that issue?
I'll speak briefly to awe. We've studied awe in 30 countries, and there are clear cultural differences. Awe feels more threatening in many parts of the world, more religious cultures, more hierarchical cultures. It's interesting, across our 30 cultures, there are kind of the more nature-based cultures for awe and the more religious cultures. And that's an interesting historical dynamic. And the more nature-based awe cultures tend to be more oceanic and positive in their feelings of awe. And what strikes me, we've gathered thousands of narratives of awe. And I believe we do have this universal biophilia, if you will, relatedness to nature, be it a desert sky or redwoods where I live, or oceans, or that it tends to have this effect on our nervous systems and our sense of self that's probably 60-70% similar across radically different cultures. And that's good news for forests and health. It's probably a pretty powerful effect.
Great, thank you. And Annika, I know that your organization is working in all kinds of different areas across the globe, and I suspect that what you've observed is probably the same as what we've heard from Docker.
Yes, and right, it's always necessary to be context specific, and I think that as we look at these, what sort of the science supported relationships are, that is going to exist in the context, the cultural context where we're working, and those solutions are going to be filtered through that. So we've been coming back to this parks example, and I know that even that, for example, is going to look very different. And where you are in the country, there's examples in Australia, in Canada, in the US, in Brazil, and the emphasis really does shift based on what's culturally important, but also what's the culture of politics, for example, or of the public health infrastructure that's there. Is health insurance covering this? Is health insurance involved? Is it local communities that are owning this? And I think it varies, and it's a call to action again to practitioners to never. It seems obvious. You can't forget that you really, I mean, elevate the people who are impacted here. But I think that's it's an important point, because I have so many follow-up questions for DACA, for example, on this relationship with awe and what you're seeing, and how we might apply that in our work. And I think it's another lens with which some of our colleagues might be thinking, but not necessarily in a systematic way. And I think it's just a really rich area to move through.
Great, thanks so much. And feel free to jump in with your own follow-up questions as well. I'd love to have a conversation about all of these topics. And another question that has come in from the audience, and I'm going to kind of maybe direct this to you first, Michelle, but I know that all of you have a perspective on this, is the question is, what are the obstacles or challenges that you face in doing this work? And when I say doing this work, maybe it's doing the research and collecting the data, maybe it's implementing interventions and programs based on the data, whatever it is. Are there obstacles and challenges, and what are they? And is there some theme to where the pushback comes from?
Oh, goodness. Well, yes, there are many challenges. And I would say, as a researcher who does community engaged work, so I'm always, my research questions come from my community partners. And so taking time to build those relationships, to understand one another and trust one another, that can take decades. And, when you need to publish like right away, I need, X number of pubs per year, it can be really challenging. And so it can feel like a luxury, right, for some of us. So, but yet, to me, research doesn't, for me, it's only meaningful if it's in partnership with communities. So there are lots of challenges to building partnerships that are, that involve research and evaluation. Just there challenges to building partnerships that don't even involve evaluation research. Let's see. And then there are challenges having to do with improving and increasing nature access for individuals. And so, I'm taking two different approaches. One is more of a person-based, and second is more of a place-based. So building and expanding, improving access to nearby nature. And in Philadelphia, we've got thousands, about 40,000 vacant lots, for example. We can capitalize on those spaces as sort of nearby nature. Well, we can also take a person-based approach and meet people where they are. So in the medical system, in the schools, and wherever they are, and engaging them in nature, spaces, activities, programs there. And sometimes, that means getting people's bodies to the natural areas. So maybe we need to partner up with, Department of Transportation. We need to rethink our ways of moving people, and as well as talking to people and understanding what their concerns are. In places like Philadelphia, there's a huge concern with, letting your children leave the house at all, right, because of fear, safety concerns. And then we also have this new-ish issue of people and children especially being glued to their screens, and how do you sort of put put, and you know, how do you interrupt that whole new culture, right?
Great, thank you. Annika, anything to add?
Well, this could take, we could just focus on this, but I did just want to highlight a couple dynamics that from our perspective, thematically, we do see as particularly challenging, and we hope that this work can help intersect and intervene. One, this goes back to the question on funding, because we do have such siloed approaches, sort of entrenched rather, approaches to how we think of and solve for public health, how we think of and solve for nature-related solutions. There's not interaction between the disciplines, between how we consider and define well-being, how do we design the solutions. It was still very far and few between that you're going to see an ecologist or someone with biology or wildlife related expertise consulted as part of a public health related intervention, and vice versa. And so we're working to change that, but until that is shifted, that is a really big barrier to effectively getting louder and getting more effective and getting wider and bigger and how we're able to advance this work. And then also, I think part of the challenge is, you know, the way things are done right now, the way this gets back to the drivers and, you know, the legacy of colonialism really is those that are most impacted, those whose health is most impacted. You know, Michelle talked about vulnerability and inequities. They're not the ones that are going to be benefited. They're not benefiting then from the destruction or inaccess to those same resources. And so because of that, speaking to the powers that be, those that are in power and making these decisions about politics, about policy, about money, they're not feeling those impacts. I wonder if that's an area where those in the psychological science and discipline could help with, you know, cultivating empathy where there's just there's not an experience that those suffering these consequences, those health consequences from degradation of nature and deforestation are suffering from. And then also the time scale is different. Sometimes these health impacts are going to take a while and they take longer to show up than the time scale of the benefit from clearing a forest, for example. And that's another challenge here for us in how we make the case and get to action.
Great, thank you. I have a couple more questions that I'm hoping to get through, and one maybe we can address pretty quickly, and the other may take a little more time. The one that maybe we can address quickly or maybe not is we have a graduate student in the audience who is studying industrial organizational psychology and has raised the issue that work so often takes us out of nature, depending on what your work is, of course, but often it puts you in an office building, it puts you in a warehouse, puts you here or there. And he's curious, what are you seeing, or she's curious, what are you seeing in terms of employers and private industry taking these issues seriously and thinking about what they can do to promote an interaction with nature among the workforce, if anything?
I would briefly, I bet Michelle has a lot to say about this. I would briefly cite the Gale architecture firm that helped rework Copenhagen, you know, and just thinking about shared office spaces, public spaces, the design of schools, as we saw in the wonderful photographs of Michelle's presentation of playgrounds, bringing nature back, you know, and it's core to their design. They've had huge effects in different cities, and they've got principles. It's data-driven, very sophisticated, and I think revolutionary to that issue of how to rethink, re-nature, re-wild work.
Great.
I don't necessarily have, you know, specific policies in mind, but I have seen a movement for employers, including the federal government, to encouraging their employees to take time for wellness and counting it as work, right? And so this might be things like, helping to cover, gym fees and or, on the private side, often we're seeing wellness facilities, right, at employment, places of employment and or, nature trails on campuses, rethinking the office park. And let me think, I would have one more thing. Right, so let's see, campuses often, I'm seeing campus initiatives to connect not just student bodies, and often it's focused on mental health, maintaining student mental health, but as well, faculty and staff, that often there are, promotions, incentives for everyone to engage in, nature-based activities or nature walks together, right? And or, putting up sort of signs here is a place of, quiet contemplation, right? And spacing them out throughout campus, things like this. I've seen.
We only have a couple of minutes left, which is not nearly enough time to do this next question any justice. So I maybe am just going to be looking for a 30-second soundbite from each of you. But what's the most important thing for the future of psychological science, looking at the effect of nature-based interventions for psychological well-being, whether it's at an individual level or at a community level? Where does the science need to go? What's the big question we have to answer in order to really push things forward? Annika, you look like you're ready.
Well, just to offer that, I don't think that there's just one thing. There's just
Sure.
one thing.
Unfair question.
Yes, we reject the premise of the question. But really that there's so much more research that is needed to expand on what we do already know, but also we can act on what we already know. And I just want to really say, collaboration, and to use what we know already to be building out the research while we also, we research what we can implement now.
And I'd say build nature-focused interventions into hospitals. They're kind of open to it. There's a ton of data, fundamental questions about the body, and then it would be good for our citizenry. So that's what I would say.
Great.
I was thinking along the same lines, I would pose that question to the health insurance agencies and right, the healthcare institutions. What do you need in order to change policy, right, to support and cover, support, individuals, families, communities in changing lifestyle and getting, better access to outdoor space. And it's not just the healthcare, it's other institutions, right? I agree that we have so much evidence, right? And right, so we can act on it.
Yeah.
Great. Thank you so very much, Amy, Michelle, Annika, and Dacher. This has been just a wonderful conversation. We're just delighted that you were able to participate here today. And for everyone in the audience, we hope that you enjoyed today's discussion, and you should be receiving about a 1-minute survey to complete after today's webinar. And we value your feedback, and thank you very much to everyone who was here for the time that you spent with us. Thank you.